A stroke can happen to anyone at any time. While immediate treatment is extremely important, the aftercare is also crucial to recovery. The damage caused by a stroke can be so different with each person, so working with a team of devoted rehab specialists is key. I am joined now by Chelsea Jordan, a speech language pathologist, I should say, with OhioHealth Rehabilitation Hospital, along with former stroke patient Mary Tsunami. So I want to welcome you to Daytime.
Hi.
Chelsea, we'll talk with you. Your job as a speech language pathologist, what is it that you work with patients on?
So there are a few different areas that a speech pathologist works on. Primarily when a patient comes in with stroke, they can be affected in multiple ways. And one way is the language, so that would be more of what we call an aphasia. So aphasia can mean understanding language. It can also mean expressing language. So it may be that processing is different, that you're not able to understand directions, not able to understand really what's going on around you to be able to communicate and to follow through with, daily activities. On the flip side of that, we also have expressive aphasia, where what comes out may not make sense, but the patient may not know that it doesn't make sense. Or there's a difficulty actually trying to get the words out. You know what you want to say, but motorically you can't say it. There's also speech production. So a lot of the times the speech muscles can be affected. So speech can be very slow and slurred, very difficult to understand. There's swallowing. The stroke affects your central nervous system, so that's going to affect your throat muscles, your face muscles. So a lot of patients have difficulty swallowing, chewing different foods for different textures, swallowing different consistencies of liquids. And those are the kind of main things that we look at, as well as just general thought processes, getting through the day, managing medications, managing your finances, managing, your time. Can you judge how long it's going to take me to do something and fit it within your, your daily schedule? How are you just getting through your day?
And that is a lot of what you guys do at OhioHealth Rehab Hospital, is the daily tasks of living, right? Yes. You want to get your patient back to being able to be at home and function like they did prior to the stroke.
Mm-hmm. Our motto is that there's no place like home. Okay. Our goal is always to get our patients to home.
Let's remind some folks of the signs, the symptoms that they need to look out for when it comes to a stroke, something that they may notice and be able to call.
Okay, there's a very simple acronym that we can remember. It's called FAST, and the F stands for face. Facial drooping, facial numbness on one side of the face. That is usually one of the first indicators. If you see an eyelid drooping, a side of the mouth drooping. Arm is the A. So if one arm feels heavy, or if it all of a sudden doesn't work, you got to reach for something and that arm just kind of flops down. S is speech. If you notice slurring in the speech, not able to get words out, you wake up and all of a sudden you can't talk. That's the S. And then T is time. And that is probably the most important aspect. If you notice any of those things, time is absolutely crucial. So if you do see those things, the FAST, time, call somebody. Call your doctor, call the hospital, get somewhere that you need to be. So that FAST is the easiest, I feel, way to remember all of that.
Absolutely. Thanks for sharing that with us, too. And Mary, tell us what happened. Let's go back to the day of your stroke and how you knew something wasn't right.
Well, I actually don't remember a lot, and I think it's that I've lost the information. But one of the things that I remember saying to my husband when I was at home, that the coffee cup that I had been drinking from at breakfast had suddenly disappeared. My coffee cup wasn't there, and I said to him, something is wrong. It was here a minute ago, and it's not here now. So I think that alerted him. We went to my doctor. He just asked me a few things, like to lift my arms up. I don't even remember exactly what. And then he said that I needed to go immediately for an MRI. So that was the beginning of the process, and as I say, a lot of it I don't actually remember. But one of the first things I do remember after arriving at the hospital is that I was able to speak at that point, but later I wasn't. So I think there was an additional stroke, and after that I really couldn't speak. So my memories beyond that take me to the rehab center.
The rehab center, and they did a
Right.
lot for you, didn't they?
They did an amazing job at the rehab center because when I got there, I couldn't walk, I couldn't talk, and I pretty much thought that I wasn't ever going to be able to do any of those things. But the rehab started right away, and one of the first things I remember, a speech therapist did come. I had someone who was helping me with just, basic personal care.
Okay.
And I would say probably within a week, they were starting me to try to write my name. I remember that especially because it seemed to me like it was an impossibility, and I was thinking, this isn't ever going to happen. And that's one of the things. I could think of the things, but I couldn't say any of them. Right. And
Okay, so we're running out of time, unfortunately, but so we can see obviously what an impact it had on you, and you're doing amazing today. So thanks for sharing your story with us.
I'm glad to be able to do that.
And OhioHealth Rehabilitation Hospital, we have the phone number and the website up on screen. So thanks again, ladies.
Thank you.